my name is Aloysia Roxanne B. Madriaga, and this vlog is about health. Let's start with lesson 14, non-communicable diseases, for short NCD. These are long-lasting health conditions that are not transmitted from person to person. They are often chronic, requiring ongoing management rather than a cure, leading causes of death globally. International organizations like the World Health Organization's WHO are actively involved in prevention, control, and management efforts, advocating for multi-sectoral approaches and policy changes. These efforts often focus on cost-effective interventions and strengthening healthcare systems. These are four main diseases of NCD, non-communicable diseases: cancer, cardiovascular disease, chronic respiratory disease, and diabetes. Let's start with cancer. Cancer is a large group of diseases characterized by the uncontrolled growth or spread of abnormal cells. These cells can originate in nearly any part of the human body, and if left untreated, it can invade nearby tissues and spread distant organs. Next is cardiovascular disease, short for CVD. Cardiovascular disease is the one affecting the heart and blood vessels. It's a major health concern responsible for a significant number of worldwide. They include coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart disease. This causes heart attacks and strokes caused by blockage that prevents blood from flowing to the heart or brain. Next is chronic respiratory disease, CRD. Chronic respiratory disease are a group of conditions affecting the airways and other lung structures. These diseases are long-lasting and often progressively worsen over time. CRD significantly impacts individuals, families, communities, and healthcare systems globally. They are characterized by symptoms like wheezing, shortness of breath, chest tightness, and coughs. Examples are chronic respiratory pulmonary disease, COPD, asthma, occupational lung disease, and pulmonary hypertension. Next and last, diabetes. Diabetes is a disorder characterized by elevated levels of blood glucose, also known as blood sugar. This occurs because the body either doesn't produce enough insulin, doesn't effectively use the insulin it produces, or both. Insulin is a hormone crucial for transporting glucose from the bloodstream into the cells for energy. The rise of NCDs has been driven primarily for major risk factors: tobacco use, physical inactivity, alcohol, unhealthy diet. Tobacco use contains components that harm the body. Examples: tar contains chemicals sticky and brown. Nicotine affects increased heart rate and blood pressure. Radioactive compounds. This is known to be carcinogenic. Physical inactivity is not doing enough physical activity. This can cause increased chance of developing hypertension, risk of obesity, development of diabetes, development of depression and anxiety, and more. a chemical substance found in drinks such as beer, wine, and liquor. It can give effects like risk of stroke, risk of heart attacks, weakening the immune system, and more. An unhealthy diet is the food that lacks essential nutrients and includes excessive amounts of unhealthy foods. Back then, President Rodrigo R. Duterte had a plan to make the Philippines smoke-free. His efforts started with his campaign against tobacco while he was still the mayor of his hometown in Davao City. He banned smokers in public places in the province, making the place 100% tobacco smoke-free. This made Davao a healthy community. HR became the president back then, and he makes the entire country smoke-free. The Department of Health are in full support on this campaign, and government warnings printed on the cigarette tables for those who do not want to heed to the president's request and still wants to smoke in private areas. There are different medical institutions in the Philippines. Example, the Lung Center of the Philippines, located in Quezon Avenue, for patients for respiratory ailments. The Asthma Club Chronic Obstructive Pulmonary Disease or COPD for tuberculosis and early lung cancer support group. Philippine Heart Center, also in Quezon City, is the center of excellence in cardiovascular care. Philippine Center of Diabetic Education and Foundation INC aim to help diabetic patients to gain knowledge and awareness about the disease. Juan Alagon Place Foundation INC in Caboyo, Laguna offers for those who want to change their lifestyle and stay away from drugs and alcohol.